know, we recently marked National Fresh Breath Day, so if you're embarrassed by halitosis, it's time to take action.
Yeah, DePere dentist and WDA member Dr. Moira Kraft is here to talk a little bit more about it. Good morning.
Hi.
Let's talk first about how big of a problem really is this. I mean, do a lot of people suffer from bad breath?
It's huge. 35 million Americans, about 90% of it is from something going on in your mouth.
Ugh.
Okay, so, you know, there are people, too, who don't know, right? That can be a tricky subject.
It's hard. It's hard to tell if you have bad breath because it's you.
Right.
You know, you can smell somebody else's.
I'm kind of doing this now.
True.
I'm feeling
It's
a little
true.
self-conscious.
Well, you and I are close enough in our work relationship to be able to help each other.
We could say that.
Now, Lisa brought up Fritos back in. There are common foods, I guess, that we might eat that could cause bad breath, right?
That is true. Anything that has a pungent odor, the classics, garlic, onions, anything that's real spicy. But once it's processed through your body, that is eliminated. It's gone. So you don't have to worry about that long term unless you're putting garlic in every meal.
Okay, well, yeah, they say it's healthy, right? Let's talk about what role saliva plays, because a lack of it can be a problem, right?
That is very true, and we see that so much with an aging population where so many people are on medications, and the #1 side effect that I see in my office is dry mouth. So if you've reduced the quality and the quantity of saliva, you're going to see problems.
So how do we remedy that? I mean, do you drink more water? Are there medications that can increase saliva? Or?
You know, that's the #1 thing I tell patients. Drink more water. Okay. Reach for the water all the time. Saliva bathes the teeth and removes food particles and plaque. And without that quality saliva, we reduce the ability to keep the mouth healthy.
Yeah.
So I always recommend reach for the water, skip anything with sugar. You know, most people, sweetened iced tea, or, you know, they're always reaching for something because it tastes good. But there's so many products on the market as well, besides just drinking the water, that add moisture. Toothpaste, mouth rinses. There are some lozenges as well. The idea is, ask your dentist, wander up and down the aisles at your local store. They're out there. Just like we put lotion on cracked hands, there's things that we can do for the mouth as well.
One of the more obvious ones would be tobacco products, too. That's something that would cause bad breath as well.
Chronic, and that also puts you at risk for increased oral cancer, the staining of the teeth, all sorts of things.
It's a good reason to stay away. Other causes of bad breath can be related to oral health, right? Or lack of it, I guess.
That is very true. The #1 thing we look for when I'm first examining a patient is, are we doing a good job keeping things clean? You know, if we're not cleaning between the teeth by flossing, brushing twice a day with a fluoridated toothpaste, using tongue scrapers.
Yeah.
You know, you've got food between the teeth. It's warm, dark, moist, tons of bacteria. That food's rotting.
In your mouth.
In your mouth. Not only does it cause cavities, but it causes bad breath. And we're not even aware that it's happening.
And now, after that description, that is a motivator to floss.
Yes.
Now, you mentioned the tongue scraper. Can we show a close-up of this? I honestly have never heard or seen of this before. I mean, maybe on the back of a toothbrush, I've heard of like having that rough thing that you can put on your tongue, but this actually exists for the reason to scrape your tongue.
It does, and you'll notice there's 2 different size ridges on there, and you hold it like a little loop, and you scrape forward.
So I basically put it in my mouth like this and scrape it forward on my tongue.
It's disturbing.
What comes off?
It is what comes off.
How well it works.
Yeah, it is very true. It is very true.
How big of a role does the tongue play in bad breath?
You know, most of...
All right, Justin's going to do it. I can't watch.
No,
I don't know.
I
There's something about like stuff that comes off the tongue.
No, yeah, look at that.
My tongue feels different. Don't look.
Okay.
You know, I tell my patients the tongue is like the shade carpet of the mouth.
Okay.
You know, you think about how the tongue is formed. It just holds on to food and plaque, and the back portion of the tongue is where it all tends to sit.
And it's hard to reach there.
It is very hard to reach there, and you know, I tell my patients, I know.
It's honestly, I don't want to describe it too much.
Don't look.
I know, I'm looking.
But, you know, on the back of a toothbrush, they often have tongue scrapers.
Yeah.
It's often very soft. I don't think it does a very good job. But as I tell my patients with brushing and flossing, something is better than nothing.
Yeah. And are these available at the drugstore?
I was just about to ask that.
You can find, you're able to find them oftentimes at different drugstores. I find that the smaller drugstores carry a different variety than the large chain stores.
Okay.
Or ask your dentist.
All right. Well, so the best thing we can do is to prevent halitosis is just good oral hygiene, right?
That's #1.
Okay.
That's number one.
Yeah.
All right. Very interesting stuff. Thank you so much for coming in today. Justin and I both learned something. Oh, and she also brought these little toothpick. These are what?
They're called oval picks.
Okay.
And
I can feel it going all the way through my teeth,
all
actually.
the way, pretty much through every tooth, and there's a little texture, so it's really good for getting calculus off or preventing the buildup, especially where people struggle on those lower front teeth.
You sure you don't want to try? I didn't do the other side.
No. We're good. Thank you. I will do that in the privacy of my bathroom. There's a limit to what I'll do on
I
TV.
know. I found it.
You did. After all these years, you have found
Dr.
it.
Kraft, thank you so much for
Thank
being
you.
here.
Well, thank you for
Very
having me.
interesting conversation.
Here is
All right.
where to find more information. WDA.org. There you can find a free quarterly newsletter, tongue-in-cheek and teeth too. Look on your oral health for sensitivity information. You can also find a dentist like Dr. Kraft here. Also, try mouthhealthy.org for more information as well. We'll be right back.